PCOS rates are increasing in India for sure, but also globally. Why is PCOS increasing suddenly of late?
We are constantly exposed to so many toxins. In fact, plastic bottles that we use, the pans that we eat in, cosmetics, perfumes, candles, so many toxins. So this very well could be the reason why PCOS is on the rise.
When it comes to products, whether it's say the pads or tampons or menstrual cups, do each of these affect vaginal health differently?
Especially tampons, if they are left in longer, say more than 10 to 12 hours, can lead to a life-threatening condition called as toxic shock syndrome.
One supplement you wish every woman with PCOS would include in her diet?
Has to be.
I really wanted to understand iron, vitamin D, omega-3 really effective for managing period pain or women with PCOS.
Almost 1.2 billion people suffer from iron deficiency anemia.
1.2 billion.
Almost 10 to 40 mg of iron is lost wherever you're bleeding.
How expensive or cheap egg freezing is?
Yes. So approximately, if you include everything, anywhere between
Welcome to the Chill Hour podcast, Health and Wellness edition powered by Swisse Wellness. After doing a lot of episodes with doctors and wellness experts, we thought of doing a wellness series specially focused on women's health. And thanks to Swisse and their products, we've been able to facilitate this. I personally have used their products and supplements, and I've seen a lot of benefit in my health personally. And we've been able to do this together. And for this episode, we have Dr. Vishesha Yadav, who's a gynaecologist and a fertility expert. And honestly, आज के episode ने मेरा दिमाग genuinely बहुत खोल दिया है. We have spoken about PCOS, periods, PMS, cravings. Does chocolate actually reduce period cramps? And a lot of other things around PCOS and why are PCOS rates increasing, especially in India and also globally. बहुत interesting conversation around PCOS, around periods, around PMS, and also a little bit about egg freezing and fertility. So welcoming Dr. Vishesha Yadav on the Chill Hour podcast powered by Swisse Wellness in 3, 2, 1. Dr. Vishesha,
Hello.
welcome on the Chill Hour podcast.
Thank you so much.
How are you feeling?
Great. Pleasure to be here.
Awesome. Today we talk about a women's health topic, essentially around periods and PCOS, also about egg freezing, fertility, but primarily concerned towards periods, PCOS.
Yes.
So, are you excited for the conversation?
Absolutely.
Yeah.
Yes.
So to begin with, I just want to sort of understand anatomically what's the difference between a woman's body and a man's body. And I'm sure the obvious answer is there is a lot of difference.
Yes.
But just to sort of understand the role of hormones, because a man goes through a 24-hour hormonal cycle, so to speak, versus a woman's 28 days.
Right. So basically, hormones represent what makes men different from women. And generally, both of them have the same hormones. It's the estrogen, the progesterone, and the testosterone. But there is a difference in the production sites, there is a difference in the blood concentrations, and there is a difference in how these hormones interact with different organs, whether in a man or in a woman. Now, as you said, that yes, men do have a 24-hour window, which is when we say that testosterone has a diurnal variation. That is, we see peak concentrations of testosterone early in the morning. So anywhere between 7 a.m. to 10 a.m. is where the levels are at its highest. They continue throughout the afternoon. So that's when men feel that, they can achieve so much.
Vishesha, I want to talk about a little about pain during periods. You mentioned that when she's menstruating, she's in immense pain. And but I have from my friends around and from my family around, I've always known that a little discomfort is okay. Pain is not normal. So could you just maybe debunk or demystify the notion around it? How much pain is normal pain during a period?
Right. So unfortunately, women have been made to believe कि oh, it's just a period. उसमें उतना पेन तो होता ही है. In fact, mothers telling their daughters, even I had pain during my period, so it's not a big deal. But pain which is severe or debilitating in terms of you're unable to go to office, you're unable to go to school or college, you're unable to do any activities, you have issues with people in the house, interpersonal relationships are affected. If somebody is trying for pregnancy and is unable to get pregnant, so fertility is affected. Or if somebody is just wanting to lie down in the bed whole day and having severe form of pain, that is something which cannot be ignored. Again, usually some women also have painful intercourse if they have painful periods. This is again something which cannot be ignored because this could point towards something called as endometriosis.
When should a woman consult a doctor or an expert if she's feeling more than normal pain, quote unquote?
So if she's noticing that this is happening over 2 to 3 consecutive cycles, and it starts with just before the periods, goes on through the periods, the pain is even there, affecting your bowel function or even passing urine, then yes, it's time to visit a doctor. Please don't take it lightly.
Is there a message or something that you'd like to tell our young audience, maybe as young as their first period, for example?
Correct.
14, 13 years old, 12 years old for some people. What should they keep in mind while experiencing period early on?
So nowadays we see that the age of menarche, as we call it, is anywhere between 9 to 12 years. It differs, again, person to person, depending on your genetics, depending on environmental factors, depending on your weight. So what I would like to tell them is that, yes, it is a completely different transformation. And initially, your periods might be very irregular because your brain and ovaries are actually getting used to those signals. So your initial 3 to 4 years might be very erratic, but that does not mean that you're having PCOS or it's always going to remain that way. Give it some time. It will get better by the time you're 16 to 18 years old. But in case you're having heavy bleeding, then that's something that should not be. You should be going to the doctor.
But in terms of heavy bleeding also, Vishesha, you spoke about, again, I'm sure, or maybe correct me if I'm wrong, but bleeding is different for different women, right?
Yes.
So again, how should you, is there a normal level of bleeding that you should experience?
Usually we see that if you have to change your pads or if you're using menstrual cups, if you have to change your pads every 2 hours and it's heavily soaked, or if you have to change your menstrual cups every 3 to 4 hours, or you're leaking blood, then that is heavy bleeding. Usually heavy bleeding is always, most of the times, also associated with a lot of pain. If you're passing a lot of blood clots, again, that is not normal. So these are certain parameters which you can observe and then visit the gynaecologist.
From a hygiene POV, is there a number or is there a limit to the number of pads a woman should be changing while she's on her period?
So again, this is very subjective.
Sure.
But ideally, pads should be changed every 4 to 5 hours. Because if kept for long, they can lead to infections or even dermatitis of the vulva.
Have you seen cases?
Yes,
where
very commonly. In fact,
have...
young girls who are not really so well versed as to what they have to do. They get busy with playing or in the school. And vulvar dermatitis is very, very commonly seen in them. So we advise them to use unscented pads so that these things don't occur.
What's the most common case that you've seen across patients?
So usually PCOS, to be very honest, because many women are actually being diagnosed with PCOS, but sometimes we question whether it is actually overdiagnosis, or sometimes we even say that it is underdiagnosis, because women who are actually having PCOS are not really being diagnosed with it.
Really?
So again, yes, there are different phenotypes of PCOS to understand. That's like A, B, C, and D. And everybody does not fall into one phenotype as such. Like phenotype A is the most classical one or the most severe form of PCOS, while phenotype D is the most mild form of PCOS. So again, it has to be evaluated. You can actually ask your doctor under which phenotype do you belong to, because that kind of changes your treatment plan.
But how do you, what are these 4 types?
So basically PCOS is a triad of 3 things. That is irregular periods, or having clinical or blood work hyperandrogenism, meaning you have clinical features of raised male hormone which can translate to acne or facial hair growth, or a lot of hair on your body, hair loss, or your blood levels of testosterone are higher than normal. And the third one is that when you are doing a sonography done, your ovaries are actually looking polycystic, like they are enlarged ovaries. Usually we consider them as more than 10 cc in volume.
Okay.
So these 3 will classify as phenotype A if all are present. But B, C and D will have either of the 2.
Oh, all 3 of them?
Yes.
Got
all
it.
3 is phenotype A.
So all 3 is phenotype A.
Correct.
And then B, C, D may either
2 out of
3
will be present.
But then what's the difference between B, C and D then?
So D is the mildest, because D, your
so
ovaries...
it's the levels.
Yes, it's the levels. So
Okay.
D is the mildest because your ovaries will look polycystic, but you won't really have so much of metabolic abnormalities, which is present mostly in A, B and C.
Oh, so
that's
D
the
is the
difference.
mildest, and then B, C, D are varying levels of whether it's mild or heavy or intense.
Yes. Also, we have something called as PCOM, wherein it's called as polycystic ovarian morphology. So the ovaries will look polycystic, but because the woman is not having any raised androgen levels, no insulin resistance, she will not be really classified as somebody who has PCOS.
Got it. In terms of periods, I also wanted to understand, there are a lot of women who, when we've done a couple of episodes on women's health, we've also gotten a lot of questions where people have said that we're experiencing irregular cycles.
Right.
Why do periods become irregular for women?
So irregular periods again can be seen in 2 situations. One is if a girl has just got her periods, they will be irregular till your body gets adjusted to it. And secondly, very commonly we see it in PCOS. So what basically happens in PCOS is that your brain is sending a signal to the ovaries to grow eggs. Okay. Now in women with PCOS, we usually have a lot of eggs. That's a plus point.
Okay.
But what happens is when the brain is releasing the hormone, that gets diluted among all these eggs. And that's why they're always stuck in the follicular phase of the cycle that we discussed. They just don't grow. So this leads to getting them stuck in that follicular phase of cycle. There is no egg growing, lot of hormone imbalance happening, and hence can lead to irregular periods or even anovulation. That is, they don't just ovulate at all, which can again be an implication if somebody is trying to conceive. And then irregular periods can also be there if your other hormones like your thyroid, your prolactin are not under control. So we need to rule out these parameters also.
What percentage of lifestyle factors or regular eating or sleep or stress, does that also sort of regulate periods?
Yes, stress, yes. Not acute stress as such, because our body can handle that really well. But chronic stress can lead to raised cortisol. It literally puts your body into a fight and flight mode. So the body will only do what's important, and other functions are all compromised. So yes, stress can play a big role. There is something called as stress amenorrhea. If somebody has gone through a very traumatic event or very bad stress at work, or somebody like a young girl who's in college or exam stress, she cannot have her periods for 2 to 3 months.
Really? 2 to 3 months?
Yes, or even more, in fact. So this is something what we call as stress amenorrhea. Very common. And
is
also,
there an age group?
Not really. Can happen to anyone. Usually we see it in younger girls. And also women who are very, very lean. If their BMI is less than 17, again, they have a lot of irregularities in their periods.
So as a doctor, in terms of what does a healthy period cycle look like?
Yeah. So, yes, a regular period cycle anywhere between 28 to 35 days. And
So 35 days is also normal?
Is also normal.
Okay.
Yes. And you are bleeding moderately. It's not bleeding associated with clots, or it's not scanty bleeding. And there is no severe pain associated with it. Is what we can classify as a normal period.
Normal period cycle. Awesome. In terms of, now again, there's a lot of misconceptions, a lot of notions around sanitary products.
Yeah.
Right? I have seen, because I come from a native, my native is Rajasthan, so I come from a very small town in Rajasthan. And I've seen young girls and women still not wear pads and use other alternatives, which is not very healthy when they're on their periods. Especially in the, now everywhere pads are available.
It's become better now.
It's become better, but it's not really solved the problem.
Correct.
Overall, I think when it comes to products, whether it's, say, the pads or tampons or menstrual cups, do each of these affect vaginal health differently, or is it's just an alternative?
So, again, it's a personal choice, to each one its own. I always tell my patients that you choose the product which is most comfortable for you, depending on your work routine, your schedule. But in short, these products have no evidence of affecting your vaginal health as such.
Okay.
So the vagina does have a lot of healthy microorganisms. That is the lactobacilli, as we call it. But what happens during menstruation is that the pH level always increases. It becomes more alkaline. So it can lead to increased infections. So these products as such, whether it is pad, whether it is cups, don't really cause infection. But if they are used incorrectly, then yes, it can be dangerous. Especially tampons, if they are left in longer, say more than 10 to 12 hours, can lead to a life-threatening condition called as toxic shock syndrome.
Toxic shock syndrome?
Yes.
What is that?
So that is actually a life-threatening bacterial infection because of the tampon that has been left inside, and you probably forgot to get it out. So tampons as such don't cause this, but if not conscious about the time, then this can be a side effect.
Oh.
Menstrual cups, again, you have to make sure that you are washing them properly, you're sterilizing them properly, and then inserting it. Because again, if you do not do that, you are prone to infections.
So like you mentioned about pads, every 4 to 5 hours changing a pad would be a healthy...
Would be a great idea.
Hygiene. In terms of cups also, is there a time frame?
Yes, so usually around 8 to 10 hours.
So twice a day?
Yes.
You would say?
Yes. And tampons at least every 5 to 6 hours.
Got it. I actually wanted to sort of, as a man actually, because I have a lot of friends, a lot of female friends who go through periods.
Right.
I actually had a conversation with them that, hey, I know it's painful for you, but I also want to sort of, I came across this thing called as a period simulator.
Yes, I have read about that.
Where I've seen a lot of reels where men actually go and take the period simulator just to check how much pain they can endure.
Yes.
So if you could explain to the men watching this episode, from a period pain perspective, is there a way to explain how much pain they go through? Because that pain we can't go through.
Yeah.
But then is there an alternative that you can mention, that you can think of? Ki yaar, imagine this happening to you at the same time. The pain caused from this would be equivalent to a period pain. Is there an example that you can think of?
So the period pain is usually consisting of cramps. So it's like that on and off bad pain. Sometimes bad period pain is very much equivalent to labor pains, So there have been simulators even which were used by men to understand how labor pain can be so painful.
So it can get as heavy as labor pain?
It can in severe cases.
But that is when they should be
Yes, they should
checked.
be visiting the doctor.
Oh. I actually want to try a period simulator
right?
and just to sort of get a...
No, it's bad, believe me. People compare it to breaking so many of your bones at once and all of that. But
is it true? Like breaking a lot of bones together, would the pain caused
by that? See, we don't really know whether it can be compared to that, but it can be really intense. And it should not be ignored.
It should not be ignored.
Yes.
Awesome. I mean, मतलब पता नहीं, मेरे को बस ये लगता है कि अगर हम even men around women, if they understand a little more, a little better, and maybe once a man goes through that pain simulator or a period pain simulator or a labor pain simulator for that matter, I think they'll be a little more empathetic.
Correct.
Not that they're not. I'm sure a lot of men
No,
are.
a lot of men are nowadays.
But
to
I'm
be
just
very
saying that in
honest.
if we just maybe younger men who've just understood the concept of periods and menstruation.
Yes.
I think if they sort of go through a periods pain simulator, they'll sort of
Yeah.
be a little more empathetic towards women menstruating.
Correct. We should keep this like a prerequisite. In fact, women should keep this as a prerequisite. Oh, if you want to date me or get married to me, you need to try
Imagine this
out.
happening in India. Vishesha, I want to talk about PCOS. You also mentioned that especially during, if she's having PCOS, periods can be a little irregular.
Yeah.
There can be body image issues, acne, weight, etc., etc. Firstly, you also mentioned about PCOS and PCOM. So, firstly, what is PCOS?
It is a mix of metabolic and endocrine disorder. It's a complete systemic inflammation in your body. And as we talked about the triad, that all these three symptoms is what makes PCOS. That's how we diagnose PCOS. So
Can you repeat that once for the audience?
It's irregular periods. It's either you have acne or hirsutism or hair loss, or if you check your blood levels, you have raised level of testosterone hormone. And the last one is that your ovaries look polycystic or enlarged on sonography. These are the three criteria.
And sorry, what was the second one you mentioned? You mentioned about
acne.
So
yes.
How much acne is normal acne? Because how does a woman tell that, hey, I am having acne?
Yeah, true.
But would that...
So if you're getting like a pimple here and there just before your periods, that's okay. But if you're getting acne which is not responding to any treatment, applying ointments or creams or taking just medications is not going to help it if you don't correct the root cause. So that's when treating raised androgen levels can get your acne down.
Got it. So yeah, sorry, you were saying about... so these were the three basically...
Yeah, so these are the three criteria that we look into. And what happens in PCOS is that because of hormone imbalance, that is, there is a lot of disturbance between your FSH, your LH, these are released by the brain, and again, dysfunctional estrogen levels. We also have raised androgen levels.
Okay.
And the culprit or the hallmark of PCOS is insulin resistance. Now, insulin is a hormone which is released by our pancreas. This is going to adjust your blood sugar levels in the body. In insulin resistance, the sugar levels increase in the body because there is resistance. So there is no proper processing of that. And this insulin resistance, along with increased androgens, forms like a vicious cycle.
Okay.
That's how you have irregular cycles, you have acne, you have facial hair growth, you're unable to lose weight properly because of the insulin resistance, and so on and so forth.
So because of insulin resistance, the sugar stays, and because of sugar stays, the weight increases.
Yes.
And because of that, the PCOS stays. It's a cycle.
Yes. To put it simply for everyone to understand. Yes.
Got it. But then we've been hearing that PCOS rates are increasing in India for sure, but also globally.
Yes.
So why is PCOS increasing suddenly of late?
So, you're absolutely right. I mean, the global burden of this disease is actually increasing. And now we are talking about something called as environmental toxins or endocrine disrupting chemicals. Lot of research happening on this, even internationally. So these are nothing but substances which can either mimic or block your hormone synthesis and cause a lot of dysregulation in the brain-ovarian axis. So because of all these things, because of so much of urbanization, so much of pollution, we are constantly exposed to so many toxins. In fact, the plastic bottles that we use, the pans that we eat in, cosmetics, perfumes, candles, so many toxins. So this very well could be the reason why PCOS is on the rise.
What is the alternative to this? What's the solution to this?
Stay away from environmental toxins. So you have to make sure that whatever products you're using are BPA free or phthalate free, because they can actually interfere with your hormones. And we don't really realize this, but in the long run, it does. It impacts your periods, it impacts your fertility, it can even lead to higher, rates of miscarriage if somebody is trying to get pregnant. So make sure that whatever you're using, you're mindful. Very important.
Got it. So you also mentioned about lifestyle factors and lifestyle choices. Does stress and sleep and model lifestyle choices also affect your menstrual health?
So stress, yes, as we discussed, if your cortisol levels are always going to stay high, they are going to impact your menstrual cycle. Because see, all the hormones are all correlated, whether it's your thyroid or estrogen or FSH, they are all correlated. So cortisol is going to cause havoc. Sleep, often ignored, is a very important parameter. I mean, not just the number of hours that you sleep, but the quality of sleep. Because that, again, the circadian rhythm and the sleep cycle is going to impact your hormone balance. In fact, there are studies to prove that women who are having PCOS usually have disturbed sleep. So we like to give them a very small dose of melatonin to improve their sleep quality, and it really works wonders. Even magnesium for that matter. And there are studies to show that if a woman is not sleeping well, it can actually impact her fertility. It can decrease the number of eggs in her ovaries.
So what is the quality of sleep?
Quality of sleep, like you are having your sound sleep for most part of the night, and you're sleeping at least 7.5 to 8 hours every day. That's like the most basic.
Is that a possibility? I mean, I'm sure there are people who are sleeping 7.5 to 8 hours every night, but do you think people are not, like, especially women, are not sleeping enough?
Maybe. Sometimes, because usually they have to probably get up and do household work or go to office. If they have children, life can get very difficult. So they are fatigued and exhausted by the end of the day. Even if you're having 7 to 8 hours of sleep, is your sleep quality better? Because women with PCOS, especially those who are obese women, also have something called as obstructive sleep apnea. Okay. Which is wherein that you're sleeping well, but you are not breathing properly. And that is very different from snoring.
So so breathing during your sleep?
You are not breathing well when you are sleeping. Normally, when we sleep, we are obviously breathing, right? But in obstructive sleep apnea, because of PCOS and obesity, your breathing can be hampered. So this can lead to future implications in your cardiac health.
Oh.
Yes. So again, a very important parameter to understand.
So stress, of course, is a bigger aspect of PCOS.
Stress, sleep, and lifestyle choices. Now again, lifestyle choices, nutrition plays a very big role. The kind of food that you eat, it need not be always organic, but you have to make sure that you are staying away from processed foods, refined carbohydrates. Yes, I mean, you can have your cheat days, obviously. But overall, your nutrition plays a very big role. So incorporating more of whole grains or foods with low glycemic index, foods that are rich in protein and fiber, they really help in women with PCOS.
Got it. So lifestyle choices in terms of the right diet.
The right diet, exercise. So it can be any form of workout, whether you want to sign up for a Zumba class or you want to go for a walk or you just want to go swimming or gymming. Anything is fine. But according to evidence, more than 150 minutes of moderate exercise per week or more than 75 minutes of intense exercise per week. Anything is fine.
That's not bad.
It's not. It's very much doable.
150 minutes is what? 2.5 hours. That's not bad. 2.5 hours per week.
Exactly.
कर लो भाई, please.
मतलब
आधा घंटा दिन में तो कर ही सकते हो भाई.
हाँ, उतना भी ठीक है. Even if you do it 30 to 40 minutes and do it around say 4 to 5 times a week or 3 to 4 times a week, that's absolutely okay.
And even if you're going on for walks, that is also doable.
Yes, but it should be a brisk walk.
Brisk walk, yeah, not like normal walks.
हाँ, टहलने नहीं निकलना.
मतलब ऐसे हाँ earphones लगा के.
Yeah.
Got it. But I've seen that, lifestyle changes also plays a huge role in terms of sleep. And adds to a lot of stress because lifestyle is such that you're working constantly. Essentially for a working woman, whether she's a mother or not, I think lifestyle choices plays a huge role, especially when, say, at times when she's not been able to sort of eat properly or sleep properly as well. I think eating right, and if you're eating right, you're not being able to sort of get your nutrients properly, taking the right kind of supplements, that also just adds on to the entire lifestyle and makes it a little better. Absolutely. I myself have been having supplements, and I think that's
great.
Hai na?
I'm a big fan of supplements. I think you can't really get everything from your diet, and there is no harm. You're just putting good stuff inside your body. So if you're knowing what you're taking under the guidance of a doctor, supplements are great.
Is there any supplement for people with PCOS?
So yes, there is a wide range. Usually we like to advise them inositols. Omega-3 works great because it helps in reducing the inflammation. Vitamin D, again, very, very important in PCOS women, because in PCOS women, they usually are known to have deficiency of vitamin D because there is some receptor mutation in the absorption. So they should be all the more mindful of their vitamin D3 levels. And then, of course, magnesium, there's antioxidants like N-acetylcysteine, magnesium, as I mentioned, and certain trace elements also like selenium, zinc. So overall, if you can find a multivitamin which has most of these, this can really help you control your symptoms, kind of regularize your periods, and decrease your inflammation.
But definitely you should
pro supplements.
Like I had mentioned, what I understood of like what you said was insulin resistance है, उसके चक्कर में शुगर बॉडी में स्टोर हो रहा है और बढ़ रहा है, उसके चक्कर में वेट बढ़ रहा है.
Correct.
So is weight loss the only solution or the only cure for PCOS, or is there like can it be cured? Can PCOS be cured?
Unfortunately, no. Okay.
PCOS
cannot be cured permanently. It is something that you're born with, as we discussed.
You're born with, so
you can have a genetic background to it.
Okay.
So you are born with it, and it is going to stay with you throughout your different parts of your lifespan. So it will reflect differently. For example, in an adolescent, she will have irregular periods or irregular bleeding or acne or facial hair growth. And coming to the reproductive age group, that is anywhere between 25 to 35, difficulty in getting pregnant because of PCOS. Post that, in pregnancy, PCOS women have high chance of developing diabetes in pregnancy, high blood pressure in pregnancy. And once you have menopause, that is your periods have stopped, they again have high chances of developing heart diseases, diabetes, and sleep apnea. So unless you are keeping it under control, you cannot really get rid of it. It's like an unwanted subscription that you have to understand how to manage.
But then how does a woman keep it in control?
So to keep it in control, yes, as we spoke about the weight loss part. See, weight loss is not the only thing. I understand that many women are just told कि हाँ आप वजन कम कर लो, बाकी सब ठीक हो जाएगा.
Correct.
But it's very important to understand that what her schedule is, what her routine is, how she can incorporate a complete comprehensive approach. Because it is not just about losing weight, it's about altering your body's composition. It's about decreasing the fat distribution. Usually PCOS women have a lot of central obesity. So that
central obesity
is more around the abdomen area.
Okay.
So that is something which will multiply your insulin resistance. So different types of exercises. It should not be just going to the gym, especially combining your cardio with strength training. That really helps with insulin resistance.
Heavy lifting is also recommended?
Yes, so it's not exactly heavy lifting, but if you are lifting decent weights, which is actually strengthening your muscles, that can decrease your insulin resistance naturally. You don't really have to take medications.
So you're saying that it can't be cured permanently, unfortunately, but it can be curbed.
Yes, very much curbed. Like we have seen women who have PCOS but are living such healthy, amazing lives. So it all depends on how you learn to manage it.
We now have a Swiss segment. It's a health and
interesting.
wellness segment. Thanks to Swiss, who's been able to help us do that. So we have a Swiss segment where it's divided into two parts. One is a myth and fact segment. I'll throw you 5 statements. You can tell me whether it's an absolute myth or there is some factual sense to it. The second is a quick rapid fire. It's not like coffee with current, but then rapid fire. The chill hour version. So, are you ready?
Yes.
Awesome.
Let's
Myth or fact? Birth control pills can fix PCOS.
Myth. So, birth control pills can be a temporary, like a band-aid for treating your PCOS symptoms. That being said, yes, for women who are actually having very irregular periods and in spite of weight loss or lifestyle changes, they just don't have regular periods, birth control pills can be actually a great option. So, even in women who are dealing with acne and hair growth, birth control pills are really a savior because they decrease your testosterone levels, and for women who are not getting regular periods, they help them get periods every month so that the lining of the uterus does not collect inside, because that in future can lead to increased chance of endometrial cancer or uterine cancer. So again, this is very common in PCOS women. So yes, birth control pills are not the only treatment that can fix PCOS for good, but again, they are not a bad option either. If taken correctly under guidance, they can really be helpful. We have seen so many women who are actually glad to go on, birth control pills because it makes them feel better.
Got it.
Also many people feel that, if I take birth control pills, it is going to impact my fertility. What if, I want to get pregnant in the future and this is going to harm my ovaries? So birth control pills as such will not harm your ovaries. But sometimes what it does is that it can mask your ovarian reserve. Meaning if somebody is dealing with a less egg count, is on the birth control pill, will never actually realize that they have a less egg count because they are getting their periods every month. So life goes on normally.
Correct.
So best advice would be, if you have been on the birth control pill for a year or more, you can go off it. Make sure you do all your tests to evaluate that you're fit to continue taking it. Check what your ovarian reserve looks like after going off it for 3 to 4 months and then go back on it.
Got it.
That way you understand where you're standing.
So again, it's both ways and should be done under the guidance of a gynecologist.
Correct.
Awesome. That should be like the disclaimer for the episode.
Has to be.
Second one, omega-3 supplements can help reduce period pain.
Yes. Because omega-3 supplements have anti-inflammatory properties. And there is enough evidence to show that they help in menstrual cycle, in your hormone balance, even a lot in your fertility. So I call omega-3 as the wonder nutrient.
Wonder nutrient, omega-3. Yes. Get it from Swiss. Vitamin D deficiency is linked with irregular cycles in PCOS.
Very much.
Yeah.
It's a fact.
Isn't vitamin D deficiency a normal occurrence, especially in India?
Most of us are deficient in vitamin D3 levels, and especially in PCOS women, we see this very commonly. So vitamin D3 for PCOS women, yes, even for women who don't have PCOS, for their normal menstrual health, for their fertility health, very, very important. And it's always important to take the correct course of it and also then to take the maintenance dose of it. Because then again, we are not really exposed to sun. I mean, we don't really go out and sit in the sun. So the levels come back crashing down. So it's very important to keep taking maintenance doses.
So also with the right level of nutrients and lifestyle, I'm sure you can't get all the necessary nutrients and vitamins. So definitely go out in the sun, sit as much as you can, but also take the right dosage of supplements to get that done.
Yes, it should be a combination of both things.
Combination of both. Awesome. Eating chocolates during periods actually helps reduce cramps.
Somewhere in between, I guess. It's not really a myth also. But yeah, I mean, dark chocolate, yes.
Above 70.
Yes.
Caffeine makes PMS and period pain worse. Is that true?
It does. Because, see, caffeine, again, for coffee lovers, they don't really want to go off caffeine. But caffeine can cause inflammation. Especially, it can increase your period pain or, even increase your symptoms of PMS. So what we recommend is usually not more than 150 milligrams of caffeine per day. That amounts to somewhere around 2 small cups or like 1 big cup that you can have with your breakfast in the morning.
Would
I
be
think
how
that
much?
should be
A larger cup.
Yeah, like once a day, that's all is okay. Yeah. How many cups do you have?
Let's not go there. 2 cups. I think 2 cups of this. Half a mug of this should be good. But I don't consume coffee as such. I'm a chai lover that way. So I usually consume.
Exactly.
But then I have sugar free. I don't
Great. Very
sugar
good.
less, not sugar free, sugar less. Awesome. We now move on to a very quick rapid fire segment.
Okay. I hope you have a hamper for me.
We definitely did have a hamper for you. It's a lot of love and a lot of adulation for
Yes.
you. One period myth you would want to bust forever.
Don't ignore if you're having painful periods.
One supplement you wish every woman with PCOS would include in her diet. What would that supplement be?
Has to be omega-3 and magnesium. And actually even inositols. Like inositols work as great insulin sensitizers for women with PCOS. So I think all 3.
All 3.
Yeah.
One habit women should drop immediately for better hormonal health.
Stay away from environmental toxins. I mean, try to rather. So be mindful in what you are, drinking water from, eating from, your cosmetics, because they can actually play a very big role.
That helps. One supplement that can help reduce period pain.
Yes, off-the-counter drugs are many, but I think magnesium along with vitamin B6 again is very great for PMS or period pain. You can actually try that.
Got it. One vitamin deficiency most women don't realize they have.
Vitamin D. I mean, it's always there.
All right. And the last one is one supplement that actually helps improve sleep during PMS.
Melatonin.
Yes.
So, again, how much melatonin you are taking, that's important. So, anywhere between 3 to 5 mg is a good enough dose. That should be enough. Even magnesium rather helps you with better sleep. So, whatever suits you better.
Awesome. Again, under the guidance of a doctor.
Yes.
Awesome. We'll keep that as a disclaimer point when we move forward. Since we are at supplements and hormonal health, and we have spoken about hormonal supplements initially in our earlier conversation as well, I also wanted to sort of discuss that since it's established that supplements are a great way to manage hormonal health along with the right diet and lifestyle, I really wanted to understand, are supplements like iron, vitamin D, omega-3 really effective for managing period pain or women with PCOS?
So iron, yes. Actually, iron deficiency anemia is the most common cause of anemia that we see. Almost 1.2 billion people suffer from iron deficiency anemia.
1.2 billion?
Billion, yeah. And whenever we get our monthly periods, almost 10 to 40 mg of iron is lost whenever you're bleeding. So iron, yes, is very important. And when you take it along with vitamin C, the absorption is much better. So a combination of iron, vitamin C and certain amino acids, this combination is great to keep your iron levels under check.
But how can they know if they're anemic?
So usually if you're a woman and your hemoglobin, which is usually reflected in a CBC report, if that is less than 12, then yes, you need to be treated for anemia. There are some women who have chronic anemia. They need further evaluation to understand why their hemoglobin just doesn't increase. Their hemoglobin sometimes just doesn't go up beyond 7 or 8. But that is not something that is to be ignored. You actually need further evaluation and what best form of absorption can be given to you for iron, like whether oral or sometimes even IV drips can work for you.
Got it. Is magnesium really a game changer?
Yes, I think magnesium, yes. For both women with PCOS and with PMS. Again, in PMS, if you combine magnesium and vitamin B6, it works really well. In PCOS, again, it works by regulating your sleep cycle and as an anti-inflammatory, and even decreasing your insulin levels. Here also a combination of magnesium with some vitamin D, zinc, calcium is a great combination.
We also spoke about omega-3
Yes.
fatty acids, which is fish oil and flaxseed oil. That also helps reduce inflammation.
Absolutely. Absolutely. In fact, there are studies to show that it helps with correcting your hormones. It helps in making your egg quality better, even for sperm health and even for embryo implantation. So somebody who's also trying to get pregnant, omega-3 is a great kind of supplement to have.
But again, what about the dosage? Should be
Usually
consulted
anywhere between 600 to 1000 mg is a great dose to take once a day. That should be enough.
once a day. And how about vitamin D? You mentioned about vitamin D
Yes.
taking with some other supplement or vitamin D in.
So vitamin D in itself is okay, or you can even combine it with calcium. Again, vitamin D plays a very huge role in women's health. There are receptors of vitamin D which are found on the surface of the eggs. So that's how vitamin D deficiency can lead to irregular periods or menstrual cycle imbalance. Again, vitamin D in PCOS women, very important, helps decrease your insulin levels, helps decrease the inflammation. And vitamin D is also helpful in making your eggs grow properly. So if you're somebody who's trying for a pregnancy, if there is decreased vitamin D3 levels, your calcium levels are going to get dysregulated, and this can lead to arrest of eggs in the follicular phase. So, lot of roles vitamin D has to play in your body. So, make sure you're
So
taking
D
your
taken
D3
with
levels.
calcium is better in that case?
Ideally, yes. Yes.
D taken with calcium.
Yes.
And iron taken with omega-3.
Vitamin C and amino acids. But yeah, iron and vitamin C is also a great combination.
Got it. And how about gut health? Because,
Yes.
and I'm sure, does gut health also play a role in regulating hormones in periods?
Very much. So again, there is a lot of research happening in gut health. So basically our gut has trillion of microorganisms, like so many of different bacteria, virus, fungi, lot of them. And they all play a role in so many things. Like digestion is just one of them. But regulating your hormones, vitamin synthesis, hormone synthesis, and your immune system, even the neurological part of it, everything is guided by the gut. So the composition and the function of the gut is very, very important to consider. Whenever dysbiosis happens, that is imbalance in the gut bacteria, that's when you are likely to develop metabolic disorders or autoimmune conditions or even menstrual irregularities, especially PCOS. Again, lot of studies which have linked PCOS to gut dysbiosis. So, very important. And how you can make your gut better is obviously by making sure that your processed foods are at its minimum. Again, high fiber. I mean, we always talk about high protein, but high fiber is also so important.
Can you give us examples of food that can be consumed?
So, high fiber can be whole grains or green leafy vegetables. All fruits and vegetables are basically high in fiber. So, yeah, I mean, people do not want to eat their veggies, but at least one meal in a day should include a good bowl of salad.
Since we were talking about periods and PCOS and all of that, one thing that I was very clear that I want to talk about a little bit is the egg freezing process. You mentioned that the 20 to 25, the age group is most
Peak
efficient or
reproductive
peak
age.
reproductive age. And you can also go till about 35-ish,
Yes.
34, 35-ish. But then the other alternative, if women want to reproduce, but then don't want to do it at a certain age, egg freezing becomes an option. So what is the egg freezing process like? How does the egg freezing work? And how costly or how cheap it is, especially in India?
Yeah. So I think egg freezing is a great scientific advancement that we are actually having access to. And nowadays, the new normal age to get pregnant is somewhere in your late 30s. I mean, gone are the days when women want to get pregnant in their early 20s. People have so many priorities, like career priorities, financial priorities, and the most common, finding the right partner. So yeah, that actually is the most common reason as to why the egg freezing process can actually help you for. So what we actually try to do in this process is that we are storing or freezing your eggs for future use. Now, this can be done either for medical conditions. For example, if somebody has, cancer and is undergoing cancer therapy or treatment, we usually advise them to freeze their eggs prior because the chemotherapy or radiotherapy can completely destroy their egg reserve.
Okay.
Or egg freezing could be done for social reasons. So when we do it to delay pregnancy, because you don't want to get pregnant right now, is called as social egg freezing or planned oocyte cryopreservation. So this was actually experimental till 2012. But since then, the American Society of Reproductive Medicine has actually made it a part of the normal IVF cycles.
Okay.
So people all around the world are using this, and I think it's a great idea for women who don't want to get pregnant right now. Because once you are crossing your 35 years of age or even in your early 30s, nowadays, in fact, because of premature menopause, we see this in early 30s, your egg count is going to decline. Post 35, even the quality is going to decline. So the process basically consists of you taking certain hormone injections for 8 to 10 days, starting from day 2 of your periods. Again, these hormones are not going to harm you in any way. We are giving you the same hormones which are released by your brain in every period cycle. We just give it from outside because instead of that one egg which ovulates every month, we want all the eggs that are present in your ovary to grow.
Okay.
So the more the merrier, right? That's why we give you hormones for around 8 to 10 days. And then after 10 days, the egg retrieval procedure is done. Now again, this is done under short anesthesia. It's a daycare procedure, hardly takes 30 minutes of your time. And you go back home the same day. Most women resume work next day or maybe the day after that. So 10 to 12 days of your time wherein you can continue with your routine, schedule, everything. But I think this is nothing as compared to later on regretting it that, oh my God, why didn't anybody advise me to do this prior? Because the age at which you do it is the most important.
And what should be the age?
So there is no magic number again.
Of course.
It's the earlier the better. Usually if you are in your, say, any time before 35 years of age. So the slot between 25 to 30, 32 is ideally the best. We do it even for women who are post 35 also because again, genetics are different. Everybody's bodies are different. So sometimes even at 37, 38 or even 40, we see women who have a good reserve or a good number of eggs. But again, the quality can be a little compromised.
So you're saying that for people, a good scientific reason is they're not able to find a partner.
Yes, that's the most common reason.
And because of that, they're going for egg freezing because what if they find a partner later on in life?
Absolutely.
They don't want that zone where they, even if they want to conceive,
Correct.
they're not able to later
Correct.
on because of the clock.
Yes.
So that is one reason. The other reason you mentioned is that they feel So talk to me a little about the process. Can you really work while you're on injections?
Yes,
you can go about
absolutely.
your daily life.
So the injections are supposed to be taken every day at a 24-hour interval.
Okay.
And you can even self-take these injections because they are not really the actual injections that we are, used to taking. They come with very tiny syringes. You can even self-inject it yourself. It's that simple.
Oh.
Yes. Or we can give it to you. But yes, women in all over US, they all self-take it. So it's not really very difficult. Yes, can cause a little discomfort, but it's not painful as such. And even though they are hormones, once the egg retrieval is done, the woman again gets her period in 10 to 14 days and all the hormones are flushed out of your system.
So it's as normal as your regular period cycle
yes, so
after the injection period is over.
Correct. So we are basically only using that period cycle whatever cohort of eggs were released in that period cycles are utilized and frozen.
And there's no particular age where one should get done. You mentioned the earlier is
Earlier
earlier the
better.
better. Yeah.
Yes, always.
So
always.
So starting from 25, is that a benchmark that you guys follow in general, or is there?
Usually before that, women are not even clearer as to,
Whether
what
they
they want to
want.
do with their lives in general.
Right.
So 25 is a good enough age to start with, but usually what we see is women come somewhere around 30, 32. That is again a great age. But if you are having history of premature menopause in your family, for example, if your mother had menopause in her early 40s, you have to be very mindful that when you go to your gynecologist, you should get your AMH levels checked.
What is the AMH level?
AMH is the anti-Mullerian hormone. It is a simple blood test which helps us understand what your egg count is. So this blood test, we then correlated with a quick sonography finding of checking visually how many eggs we see in your ovaries. So that can help you decide, because if you have a low AMH, then you need to do the egg freezing part as soon as possible so that you can get the best eggs before you lose all of them every month as you grow older.
So medical history becomes really important.
Yes, it is important.
Genetically and hereditary wise also, I think if you have some history, you should get it checked.
Yes, for example,
the AMH checked.
Yeah, if you have endometriosis, it is known to affect the egg count and the egg quality. Even in PCOS, even though we have a lot of number of eggs, which is a plus point, but the quality is not going to be the best, and age only worsens it. So even though your AMH levels will be great, does not mean that you can wait till you're 40 and then I will see what to do.
Do you think more and more women are going for the egg freezing process nowadays?
Absolutely. I think there is a rising awareness. Actually, when I had gone to the US for training, I noticed that almost 50% of cycles there are egg freezing cycle. So there people are very, very aware. Actually, mothers used to get their daughters and be like, okay, this is the birthday gift for my daughter. I want her to freeze her eggs.
And that's wonderful.
Actually, yeah. And in India also, like, people are understanding more about it. Yes, there are still so many ifs and buts, but if you talk to a doctor to understand what it actually consists of, it's not really that overwhelming as one might think it is.
But what is the taboo around egg freezing, especially in our country?
So people feel that hormones लेंगे तो body will get impacted. Natural pregnancy हो नहीं सकता एक बार ये कर लिया तो. So this is just like an insurance policy. I mean, you have stored and frozen your eggs for future use. Whenever you want to get pregnant in the future, you please try naturally first. In case that does not work for 3 to 6 months, you're trying and you're not conceiving, then you at least have the option of using what you have stored at a younger age. And that is definitely going to give you a better pregnancy rate.
Got it. But what's the relation between, say, an egg freezing process or the fertility with hormonal health in general, in terms of a period or the menstrual cycle, and actually ovulation and fertility? So वो relation क्या है between the menstrual health and fertility?
So yes, menstrual health and fertility are very intrinsically linked. If there is anything off about your periods, meaning if your periods are getting shorter, like you were having a 30-day cycle and now it's come down to 23, 24-day cycle, it is a red flag, because probably you are having a diminished ovarian reserve. That's when you need to do your AMH levels and understand where you stand. Or if you're having any longer or irregular periods, then you know that you have probably PCOS. You are not ovulating. And that again can impact your fertility. Also, the blood flow in your periods. If you're having very heavy periods, probably you have fibroids. So So fibroids again are benign growths, or to put it in simple language, non-cancerous growths, which can occur in different parts of the uterus. Now, all fibroids are not really harmful, even for general health and even for your fertility. But certain fibroids, which are actually sitting inside the cavity of the uterus, can come in the way of fertility. Or if they are very big in size, again your fertility can be impacted. So heavy periods, make sure you do a scan just to check that everything looks okay.
So scan would be the AMH scan.
No, scan is the sonography.
Sonography scan. Okay.
AMH is the blood test.
Got it. So these are a few tests that you would say
Yes.
recommend any woman to go through, and then you basis the test result you would say recommend ki maybe if you want to go for an egg freezing, do it ASAP.
Correct.
Or
just if you're trying to conceive, you just want to know that it's just like what we call as preconceptional counseling. You just want to know how and where you stand in terms of your ovarian reserve, in terms of your overall health, even in terms of your partner's sperm health. Because to make a healthy embryo, you need both a healthy egg and a healthy sperm. Again, the male partner is usually, something which is ignored. Male infertility is not spoken about so much. But we have to understand that it's actually 50-50%. So it has to be both evaluation and then trying for pregnancy, even if you're doing it naturally.
So, sperm freezing is also a concept?
Yes, sperm freezing is also a concept. And again, it is used in men who are undergoing any cancer therapy. So before that, we freeze their sperms. Again, men who are more than 40 years old and have not yet tried for a pregnancy, there are studies to show that, age as such in men does not really impact the sperm count. But what we have found out is that in men more than 40 years old and who have got pregnant, we have noticed certain neurodevelopmental changes in the offsprings, like development of ADHD or autism, things like these. So again, this is a upcoming research going on. But again, sperm freezing is a very inexpensive one-time thing that you have to do. So why not do it if you have not really planned a pregnancy till you're 40?
Got it. How I also spoke to you about how expensive or cheap egg freezing is.
Yes.
So how expensive would that be approximately?
Again, it differs from center to center. It also, you have to understand that what you're trying to do here is actually store your potential babies in an embryology lab. So the conditions of an embryology lab have to mimic that of your body. So every small thing, right from the temperature to the pH, the person handling your gametes has to be to the T. So hence, this procedure can be a little expensive. There are two parts to it. The hormones that you take are a separate part, and the cycle per se, which includes the retrieval part and the freezing part. So approximately, if you include everything, anywhere between 1.5 to 2 lakhs. So the thing is, I always tell my patients that it's always better to spend this much rather than spending triple the amount of this when you're actually trying for a baby and it does not happen and you have to undergo multiple rounds of IVF. So this is a great investment which you're doing it for yourself. Like when we plan, our vacations, when we plan shopping sprees, we actually plan so much, right? We don't really think how much we are spending. So why do we have to think so much before we are doing something for ourselves, which is going to help us in the future?
What's that one myth you'd like to bust here in terms of fertility, in terms of egg freezing? Maybe some notions that young women watching this might have. Maybe a particular myth that you'd like to bust here?
So people feel that egg freezing can actually harm my body. The hormones can harm my body. But as we discussed, there is no long-term repercussions even on your menstrual health, or even when you get pregnant, or even when you menopause. So very important.
That's very important.
That's one of the most common reasons why people feel why should I pump myself with hormones?
In general,
yeah.
I think especially in a country like India, we have a lot of these misconceptions and myths because we're surrounded by people throughout.
Correct.
And we have our parents and our relatives who come from very different generation.
Correct.
So maybe वो study उनको शायद ना पता हो, maybe वो information sake से वो वहाँ से ना आते हो. Maybe from a taboo POV, a lot of people come across कि अरे यार ये तो egg freezing करा रही है, अरे यार ये सब क्यों करा रही है?
Like it's something like, it's so selfish, you're putting off motherhood just because you want to study further or you want to do something more in your career. But I mean, people used to question in the past, can women have it all? And I think with these advancements, why not?
Absolutely. I think managing ambition versus personal life becomes, it becomes easier when you have all these facilities around. You were also talking about ovulation tracking. We were speaking about that as well. So how important, you mentioned that, in the conversation we spoke about ovulation and that being the most effective phase for reproduction. How can women track their ovulation? Is there a tracker or how do you sort of track it?
Yes. So, women who are trying naturally, tracking ovulation, I feel, is one of the great things that you can do to understand your body better. And one of the ways to do it is maybe you can use something called as the ovulation kits or the LH kits. So basically, they can detect the LH hormone in your body, which is the hormone released by your brain to signal your ovaries to ovulate or release an egg. So that's a great way to try. You can start trying it around 4 to 5 days before your expected ovulation. And the best time to do it is somewhere between 10 a.m. to 2 p.m. So it's basically, it detects the LH hormone in your urine. And that's how you understand that if you do see 2 positive lines on that, you are likely to ovulate in the next 12 to 36 hours.
Got it. And that becomes imperative.
Yeah. And that's one way. There are many other ways, like many people use apps to understand, but apps are not always accurate. So you can either combine it with the ovulation kits, or you can also keep a track on how the cervical mucus looks like. When the estrogen levels are highest at ovulation, that can be thin or stretchy. That is again a sign that you're going to ovulate soon.
Got it. That's very informative. I think for me very specifically, and also for people watching this on YouTube, I think it's going to be pretty informative because we see a lot of these information pieces, but we don't really focus on a lot on these in terms of a daily reminder.
Yeah.
Dr. Vishesha, this has been wonderful.
Even I had a great time.
This was wonderful. I don't think I've spoken about periods in PCOS maybe so much at length in one go. But this was so informative. This was so enlightening as a man to hear about what essentially, and this takes me back to my first question where I'd asked you about the difference between a man's body versus a woman's body. And I think that we're closing the loop here, where we say that it is so different, not just the 28-day cycle, but in general, whether it is period starting when you're 10 years old or 12 years old, to about premenopause, to actually menopausing, and even then there could be a lot more complications. I think that's how wonderfully we've been able to close the loop thanks to you. So thank you so much for taking out time and doing this. If there's one last message or thoughts that you want to give to young girls, it could be around PCOS, it could be around periods, what would it be? As a gynecologist, of course.
So it would be stay away from environmental toxins as much as you can.
Maybe on that camera if you can.
Okay. So I think my advice would be to stay away from environmental toxins as much as you can, making sure that you're mindful about your lifestyle choices, not ignoring any symptoms. Please go to a gynec if there is some change with your menstrual cycles. And most important, if you are young and wanting to delay pregnancy, please consider or at least try to understand how egg freezing can help.
That was very concise. I don't know why you don't create so much more content. I think you're pretty ready in terms of a content creator. That was a great outro. I took like a year and a half to get to where you are right now. So it was pretty great. But thank you so much. How did you enjoy being on the show? Did you have fun? Your raw, honest thoughts of being on the show.
I really had a chill time.
Yeah.
It was great. And you were amazing. You were actually listening with so much interest. And it was fun.
Thank you. Thank you so much. This is our little attempt to spread a little more awareness around women's health.
Yeah.
And thanks to Swisse, our partner, who's been able to facilitate this. This has been wonderful. I hope after this episode, we can create a little bit of a difference, a little bit of an impact in terms of women's health. And I would want to obviously urge women to watch this, but I would also urge more men to watch this episode, because that can really open up a lot of your head in terms of what really goes on with a woman. Even if you know, this would, I'm sure, give you a lot more information. So thank you so much for watching. Please comment down your most favorite part in the comment section so that we know what you found more interesting. That gives us feedback and tells us that you are also watching the episode. We have a second channel called Deepak Pareek Clips, where we post short snippets from the main episode on that channel. So subscribe to that as well. See you in the next episode, same time next week, Friday 6 p.m. Till then, it's a wrap. Thank you so much for watching. Cheers.